think you might have it automatically set to do that?
Yeah, you're right, I did. In 2010, she became faculty at TCNJ in the Department of Counselor Education, where she teaches addiction counseling, research and statistics, measurement and evaluation, and practicum internship. In addition to Dr. Gibson, we have Jennifer Oliva, who is an associate professor at Seton Hall Law, where she specializes in health law and policy, FDA law, drug policy, evidence, and complex litigation. An honors graduate of Georgetown University Law Center, Professor Oliva was a public interest law scholar and served as executive notes and comments editor of the Georgetown Law Journal. Prior to attending law school, Professor Oliva earned a master's in business administration at, I don't know how to pronounce this, Balliol College, Oxford University. She was elected as a Rhodes and Truman Scholar while a cadet at the U.S. Military Academy. After law school, Professor Oliva served as a federal appellate law clerk to the Honorable Stephanie K. Seymour on the United States Court of Appeals for the 10th Circuit, and the Honorable Thomas L. Ambro on the United States Court of Appeals for the 3rd Circuit. She was subsequently appointed Deputy State Solicitor of the State of Delaware by then Attorney General Beau Biden. So welcome to our two presenters. Just a couple of housekeeping. If you would please mute yourselves, that would be really helpful. If you have any questions or comments, please put them in the chat. Also, our two presenters have put their email addresses in the chat. We will be recording this webinar, just to let you know, and we would like to also mention that Mercer Council on Alcoholism and Drug Addiction and the Prevention Coalition of Mercer County are hosting this Lunch and Learn. Please visit us at mercercouncil.org to find out more about our agency and our coalition. And with that, I'd like to turn it over now to our two presenters, Dr. Gibson and Jen Oliva.
Thank you, Barbara. Jen, I get more impressed with you every time I hear people talk about you. I didn't even know half of those things. So I want to welcome everyone, and thank you for coming and joining with us today. We wanted to share with you our perspective on the idea of decriminalizing drugs in New Jersey. Everyone knows that this just happened in the state of Oregon, and Jen and I are fully supportive of moving this initiative forward in the state of New Jersey. And today we want to talk to you about why that is. And we're going to start off with just a brief review of some of the drug war statistics. We know that the drug war in this country is racist. We know that the drug war in this country has failed. And we know that we spend an enormous amount of money on this drug war every year. It's also dangerous because of this drug war. It drives our overdose rates to an absolutely astronomical degree, over 68,000 in 2018. I know you just had a presentation on Portugal with Barbara a few weeks ago. They had double digits overdoses with their decriminalization of drugs last year. So I understand they have a smaller population, but regardless, they don't even use Narcan over there. They don't distribute it out in the streets, so they're just very recently starting to do it because there simply hasn't been a need. There's been a huge racial disparity in terms of arrests for drug charges in the United States, with Black people exponentially arrested more often than white people, even though we know that the drug use rates are essentially the same when we look at national data. Most people in this country accept the fact that the war on drugs is a failure, but it's also really important to recognize the source of what happens with this failure. This failure decimates communities, it decimates families. There's massive racial oppression. There's huge social and legal injustices that happen, and Jen's going to talk some more about that in a few minutes. And we spend an enormous amount of resources trying to reduce the availability of drugs. The interdiction efforts are $3+ billion a year to stop drugs from coming into this country. They stop less than 11% successfully, And the research shows it makes absolutely no effect on the rates of substance misuse in this country at all. So we're stopping a very small portion from coming in. It's changing not at all drug use rates in our country, and yet we're choosing to continue to put our resources in there. Bad financial business decision. And then there's an enormous amount of misinformation and propaganda that's been put out there, and that started with the initiation of the drug war. So it was an intentional misinformation campaign that happened in our society. So mass incarceration has been one of the biggest and most damaging consequences of this war. There's a quick video I want to show you, and I have the closed captions up because hopefully you'll be able to hear the sound adequately. But I really just wanted to drive home that about 80% of drug arrests in this country are for personal use, nonviolent drug charges. So if you think of the enormous amount of people we have incarcerated, over 1.5 million drug arrests each year, 80% of them personal use drug charges. And what each one of those arrests means for that individual's future, for their family, for their children being raised without a parent. 80% of women who are incarcerated are the primary caregivers of their children. But the long-term social and community consequences, as well as individual consequences as a result of this, are just destroying our communities. So hopefully this is just a quick 3-minute video. Oh, and of course it's not gonna work. Let me try it one more time. I just had it work for Barbara 2 minutes ago. All right, I'm gonna give up on it. So it's a drug policy alliance. It's a really great video, and I can actually pull it up maybe at the end. You can pull it up on YouTube. And Jay-Z actually put this together on the effects of the war on drug on Black and brown communities. And it shows the history of the drug and wars, and it walks you through the decimation of communities ever since we created this initial war on drugs. We know that 50% of Americans have breached drug laws. So half the people, at least half the people on this video right now, have at some point in time in their lives breached a drug law. Most of you probably have not been arrested as a result of it, because who we arrest and when we arrest people for breaching these drug laws really depends on where you live, and when you drill down to it, the color of your skin. We can't arrest 50% of the population and incarcerate them. Not only can we not, but we don't even try. We just try to arrest certain populations of people. We know that 19% of people who deal drugs in the United States are Black, but we know that 64% of the arrests for dealing drugs are Black. So about 5,000 Black men per 100,000 are arrested in the United States. 40 to 50% of Black men ages 15 to 35 are in jail, probation, or have some kind of active warrant for their arrest. This is not the statistic for white men, where it's less than 1,000 per 100,000. And we know that white men actually use drugs more frequently than Black men do. So these statistics are very real and have significant consequences on communities. So consequences of drug arrests. I'm going to turn this over to Jen so she can give us more of a legal perspective on what happens when someone actually is arrested, charged, and convicted with a drug charge in New Jersey, and what that can do to them.
Thank you, Dr. Gibson, much appreciated. And thank you for the wonderful introduction, Barbara. So there are a panoply of things that attach to even a misdemeanor drug arrest in the United States. One of the things that everyone here is probably quite familiar with is you have to disclose those arrests when you're applying for any kind of occupational licensure in the state of New Jersey, and that's true across the United States. Some states are working now to eliminate that requirement, but you're precluded from something as simple as getting a barber license if you have a drug arrest under the licensure rules that attend to the various different professions. You can't, you're no longer eligible for Section 8 housing. You can get evicted if you were in Section 8 housing, and you're disqualified. One of the other things I want to talk about, people don't realize, is that we've stigmatized drug use so much in the United States, in particular drugs, that at-will employees can be fired willy-nilly. It does not current drug use does not qualify as a disability, even if you have a diagnosed addiction or use disorder. The Americans with Disability Act has a special rule for this that doesn't apply to any other disease or medical condition, that says if you're actively using, you no longer qualify for ADA protection. A lot of Americans don't realize that. So that's a huge problem for someone struggling with a use disorder. Of course, heavy fines. There's lots of people who are rearrested and rearrested again and start getting themselves into mandatory minimums and other prohibitions that we'll talk about later, simply because they can't pay the fines and fees that attach to these things. They're often held in jails for a considerably long period of time, simply because they cannot post bail or post bond. Obviously, it's been in the news quite a bit in this election cycle. Folks lost the right to vote. Florida voters, which has a huge disenfranchised felon population, by the ballot, voters popularly reinstated the right to vote, and then the state legislature clawed that back by saying that the formerly incarcerated individuals had to pay all of their fines and fees in order to be eligible for the 2020 election, which many of them could not do. And I think folks probably who are following this know LeBron James, King James, famous basketball player, spent all of his time in the election cycle trying to raise money for folks to help them pay their fines so they could vote again. And you can be denied public assistance. A couple other things I just want to point out too is that there isn't much privacy around these kinds of use disorders or the arrest data. So you can also end up getting into all sorts of other trouble. It can create life insurance problems for you, applying for all sorts of other benefits and things that folks without these kinds of arrests or haven't suffered use disorder are subjected to. And Dr. Gibson, if you want to add anything in there.
No, this is hopefully this plays out well. This is actually something for research that we did that measures the perception of people and what they think is happening with racial injustice as it relates to the drug law. So they actually put a bunch of people in a room and they read out audio, which is on the right-hand side here, and they gave them dials. And these dials go from 0 to, I think, they go from 0 to 100, and it goes up to 53, I think is where people dialed in here. And as people talk, as they hear this read out loud to them, they turn the dial based on their agreement with it. So they turn the dial higher with things they agree with and lower with things that they don't agree with. Hopefully this will automatically play for you. When I do watch, these things all worked just a minute ago.
The laws, practices, and assumptions that govern how we treat people who use drugs have always been different for people of different races. For decades, these policies have been used to target and incarcerate people of color, especially Black Americans. Only now, as more communities experience opioid addiction and overdose, and the face of the crisis is white, are we starting to see drug use for what it is, a health issue that should focus on treatment and recovery. Our shifting responses to drugs have always been color-coded. We need to end the criminalization of drugs and people who use them, prioritize proven treatments and harm reduction, and remove barriers for people to get and stay well.
So if you look at the green line, that's New Jersey. And if you look at the perception of ending the criminalization of drugs, it's really pretty high up there. It's over 60% of people in the state of New Jersey. Really important to drill home the difference between decriminalization and legalization. We're not talking about being able to go into CVS and buy an 8-ball of crack. We're talking about if you have individual use quantities of a drug on your person, it is not an arrestable offense. So all of these consequences that Judge just talked about will not be a part of your life. It's not going to destroy your future from having individual use quantities. It does not change the distribution charges. Those aren't a part of a full decriminalization. So larger than personal use quantities would have different consequences. But here, there's a large amount of support throughout the state of New Jersey for ending the criminalization piece. And I like to pause and think about what we could do with those resources. If we're talking about 85% of people who are currently incarcerated for personal use nonviolent drug charges, if we took that money that it costs to prosecute them, to hire probation and parole officers to oversee them, incarcerate them, what we could do with that money. Like if we were to give it to the prevention coalitions across the state, what they could do with those resources instead of back end creating a consequence that ultimately creates the destruction of individual lives and communities. With mandatory sentencing, and Jen, I want you to jump in here with this too, it's creating significant problems for individuals and families. 2/3 of women who are on probation are white, but 2/3 of women in prison are African American for the same charges. When you put them side by side with the same charges, we are taking Black mothers and we're putting them in jail, and we're taking white mothers and giving them a probation officer. And prison industry is growing because of mandatory sentencing for drug-related crimes, including private prisons. 56% of inmates are serving drug-related sentences, and 70% of women are the primary caregivers of their children when they're sent away. So what's happening to those children and to those families? And so you're moving into the realm of the intergenerational trauma that's being experienced, the separation of families. All right. I'm going to turn this over to Jen, but before I do, I just want to say the concept of defunding the police, the language that they chose when putting forward this initiative, I feel is unfortunate, because defunding the police does not mean take away all of their money and have no police. That is not what defunding the police means. But it gave people who are opposed to this initiative some real fodder for conspiracy theories, which is unfortunate, but we're going to set the record straight here and talk to you about what this really does mean. So I'm going to turn it over to Jen.
Thank you. I want to go back real quick to mandatory sentencing and say that, we started mandatory sentencing really in full effect in the United States when the Controlled Substance Act was enacted in 1970. For the first time ever, enacted a federal statute that gave the death penalty to folks who dealt drugs to minors. And so theoretically, you could be in a situation, obviously, where an 18-year-old is sharing drugs with his 17-year-old cousin and could actually get the federal death penalty. This stuff happened in the 1970s, and there's any number of federal mandatory minimums now attached to a whole slew of nonviolent drug offenses. But let's talk about New Jersey, because it's really important right now. New Jersey's had 2 bills, one in the House and one in the Senate, pending since September. And what those bills intend to do is enact reforms from a 2018 Criminal Sentencing Disposition Commission report that showed that New Jersey had the highest disparity in the nation between Black and white people who are incarcerated. So we had the most sort of racist incarceration statistics in the country in New Jersey. And one of the things that was driving this was a slew of mandatory minimum laws that New Jersey has enacted over the years. Since the 1970s, the report shows you that there's been about 40 different amendments to criminal sentencing statutes, and virtually all of them ratchet up mandatory minimums or enhance sentencing instead of moving in the opposite direction. So an example in New Jersey is we have a mandatory minimum for if you are in possession of drugs in a school zone. This isn't dealing drugs to children. It has nothing. You don't have to have any contact with the child. If just the geographic area where you're picked up happens to be designated a school zone, then that really ramps up the sentence. So these bills aim to eliminate mandatory minimums and restore discretion to judges for nonviolent drug crimes. We might ask yourself, why has this not passed? And you can just do a little Google and find NewJersey.com. There's any number of articles on it just this week. One senator added an amendment to the New Jersey bills saying that official misconduct should also get sentencing relief. And so official misconduct is a sort of a white collar crime for majority white people who are in charge of public funds. And that has now stalled the bill. So it's a very interesting dynamic. We're trying to have these bills that would, equalize some racial justice based on this very careful report that was done by the Sentencing Commission. And that's sort of getting held up now in this debate. And then let's move on. I just wanted to highlight that because those bills are pending right now, and I would encourage you to look into that and become educated. They're very, very important, and it could really help equalize some of these problems and save the state a ton of money on just nonviolent simple possession charges. So as Dr. Gibson was saying, defund the police does not actually mean defund the police. What it means is to take funds that are used to enhance policing and swatting and over surveillance in certain neighborhoods and reallocate those funds for things that are health enhancing instead of health harming for those communities. All right, and we'll go to the next slide, Dr. Gibson, and you and I can do this. I'll mention real quick, I am a former military police officer myself, so I'm very much in favor of this law enforcement assisted diversion program. This was started out as privately funded in Kings County and Seattle, Washington. And the Ford Foundation funded a program that said, hey, instead of arresting people for simple possession, how about we send out a group of police officers that will help people get services? Instead of have a case or an arrest, you would get housing first and other social services. So you were assigned, instead of a probation officer or to a judge or a prosecutor, you were assigned to a caseworker.
How we doing, dear? Okay.
Please mute yourself. Hey Barb, you muted Jennifer. You have to unmute.
I know. I'm so sorry.
I got it. No
Thank
problem.
you.
Notice
Jen,
I just kept on talking. I just couldn't be stopped. Couple things about this LEAD program, and I don't know where I stopped, but instead of arresting people, we're giving them the police would help them voluntarily, give them a caseworker, and they got social services. What's really important about this program is a bunch of statisticians that the Ford Foundation paid tracked the data, and it showed that the county saved a ton of money, arrests went way down, tons of money were saved in the criminal justice system, and violent crimes and low-level crime, street crimes decreased. So it was like all positives, all goods. And so at the end of the grant, the 3-year grant fund, Kings County, Seattle actually paid for this itself because it saved the county so much money going forward. So I just encourage you to look into programs like this in the United States that have been incredibly successful and saved folks a lot of money and ended up enhancing public safety. And I'll turn it back over to Dr. Gibson.
Okay. All right. So we know about 8 out of 10 people arrested for a drug-related crime in the past decade was just for a small personal amount of drugs. And this is in the state of New Jersey. So think about if we didn't have to do 80% of our arrests on drugs. There's a huge racial disparity in this space here. This is what's going on with Oregon. With their drug decriminalization, it is projected that their racial disparities in drug arrests are going to go down by 95%. So there is some economics we want to take into consideration as well. Obviously, there's a huge social justice implication of this, but economically speaking, nationwide, there is about a $26 million criminal justice expenditure and over $3.3 billion for people with drug-related charges specifically. In New Jersey, $715 million of expenditures in arrest, trials, and incarceration for drug-related crimes. Overwhelming portion of these are for small personal use quantities. Again, these are just, this is the kid who had a marijuana gummy in his pocket, who got, busted at the Wawa kind of stuff, who lives next door to you. Who now can't go to college because he can't get Pell Grants or federal aid to be able to pay for tuition. I mean, these are the consequences we put on people. And then when he gets out, he can't vote because he can't afford to pay his fines. He loses his voice. From a clinician's perspective, I want to talk to any clinicians out there. Our criminal justice system is about 1/3 of all drug treatment referrals we have that go on nationwide. So when people are arrested, and I spent 6 or 7 years working for the city of Alexandria right outside of DC as an addictions counselor. And I would say about 95% of my clients were mandated to come see me by the criminal justice system. And this is actually what inspired me to get my PhD to begin with, watching how they lost all rights to self-determination. They lost all rights to making decisions about themselves. I was battling with probation and parole officers over 42 CFR Part 2, which is essentially the federal confidentiality regulations for substance abuse treatment, because the probation officers wanted full access to all of my treatment records, and I would refuse to give it. Even though clients wanted to sign over those rights because they wanted to comply, because they didn't want to get a probation violation and get sent back to jail, I refused, and I would have to advocate with the probation officers. I can't work with them if they can't be honest with me. If we're going to have an effective therapeutic relationship, we need to establish rapport, and we can't do that if I'm nothing but just a sieve that's going to give all their information they share with me over to their probation officer. There was an enormous amount of work that came in renegotiating that relationship together. We know that legally coerced treatment has a very diminished level of evidence in terms of effectiveness, especially when it comes to long-term effectiveness. So there are some research studies that show mandated clients can do well as non-mandated clients while they're in treatment, but those treatment effects go away as soon as they are no longer mandated. This is not long-term sustainable change that we're dealing with. This is, hey, we're going to continue to take away your rights now that you're not incarcerated, and you're still going to have to do what we said. This is really the only field in the counseling field. So I teach people how to become professional counselors. And there is nowhere in our intro to counseling course where we talk about telling clients, I have a goal for you. You have to do what I say. And if you don't do what I say, I'm going to kick you out of my program. That's not shared goal development that we do with our clients. It's only in addiction treatment do we say, you have to be abstinent to stay in this program. And then we further dehumanize them by making them pee in a cup in front of us to make sure, because we don't trust you. So here we are trying to establish rapport at the same time saying, I'm going to humiliate you because I don't trust you. I think you're going to lie to me. And then I'm going to tell your probation officer everything you say and do. None of this goes into the world of best practice treatment and establishing a positive working relationship with our clients. But this is what happens in compulsory coerced treatment that's related to substance abuse. So we have a good amount of research showing that any kind of mandated treatment is actually associated with a poor quality of therapeutic relationships, non-compliance, and low client confidence in treatment. So this is a real challenge. But when we look at what's happening in Portugal, and I'm going to show you some slides later on that, when they've removed the idea of compulsory treatment and it's all by choice, their treatment engagement went up by 60% because people are interested in going to treatment where they have the right to self-determination. So it's really important. 90% of people with substance use disorders did not receive treatment in the last year. This is 2019 SAMHSA data. And the number one reason that they're not going, if you look at this pie chart, it's a pretty good number one, right? It's a big piece of that pie. I don't want to stop using. My goal isn't to be abstinent, but I would like to come to you so that I'm no longer misusing the substance that I'm using. I would like to use moderately. I would like to go back to using recreationally. And there's an enormous amount of research out there that shows that this does happen very often, most often without any kind of formal treatment at all. It's called natural recovery. Recovery doesn't have to mean I'm not using any drugs at all, ever. Most people who have a substance misuse disorder don't sustain that substance misuse disorder over long periods of time. Most people actually stop that misuse component on their own in some capacity or seeking private individual counseling. Sometimes they go to fellowship meetings, but most of them don't do it through formal treatment. Most of them don't want to quit. They just want to address their behavior, and we're not providing that safe space to be able to do that. Or the places that are funded by our government to be able to go and seek treatment mandate that we be abstinence and don't allow us the right to self-determination to decide what it is we would like to have as our goal for our own use. So what we need to do is modify our treatment, and there has been an embracing of harm reduction model through the public health department in the state of New Jersey. We need to have low barrier, low threshold services. We need to be offering harm reduction to people who are continuing to use whatever they're continuing to use in a way that we can engage with them, establish rapport, develop relationships, maintain trust until they're ready to make a different kind of change for themselves. Because we don't offer this, we have a huge overdose problem. Because we keep telling people it's my way or the highway. And that's not how you connect with people. So I want to drill down on, I'm doing ACA and NASW. I didn't do AAMFT, so I apologize for marriage and family folks who are out there right now. But there are the values and codes of ethics for each one of these professional associations. It's very consistent with moving forward with harm reduction work and decriminalization. Both organizations have a huge support for social justice. And we started this whole presentation with the absence of social justice with our drug laws, not just diminished, but complete absence of social justice in our drug laws. So just the whole idea of promoting social justice means we need to change our drug laws, because you cannot support our drug laws and be a social justice advocate at the same time. They're conflicting. With ethics, the primary responsibility of counselors is to respect the dignity and promote the welfare of our clients, which means not having them pull their pants down in front of us and pee in a cup. and calling their probation officer and throwing them back in jail because they told us something that their probation officer says they shouldn't be doing. And avoiding harm, acting to avoid harming our clients, and minimizing basically any kind of unanticipated harm. That's what harm reduction is. Minimizing harm, reducing harm. This is literally the definition of harm reduction. With NASW, fundamentals to social work is the attention to the environmental forces that create, contribute to, and address problems in living. Those are our drug laws. Our drug laws do exactly that. And social workers challenge social injustice. And so that's what we're doing now with this initiative, is to challenge the social injustice of our drug laws. And with ethics, the right to self-determination. We respect and promote the right to self-determination of our clients, and for them to identify and clarify their goals. We're not going to tell them what they are. We're going to work with them for their goals. So I want to transition over into fear-based decision-making, because I think this is where a lot of misunderstanding comes into play. This is where conspiracy theories dig down and put in their roots. We are going to scare you. We are going to make you think that all of these horrible things are going to happen with this. And you're going to be so scared that you're going to decide that facts don't matter, or you're going to create alternative facts. And we're going to make you so scared that you continue to embrace oppressive policies because you don't want bad things to happen. And that's essentially where our drug laws came from. And I have some quotes on the next slide that I'll show you. But we know that research shows emotions affect decision-making in certain ways that actually undermine any sense of rationality at all. So that we have historical literature that is just littered with accounts of how the drug problem became a problem through concerns that were essentially moralistic, prejudicial, racist, and just promoted abject fear rather than about any kind of reliable knowledge of drug risk, drug use, or drug supply. So we don't actually provide our education in a way that is informative. Instead, we do these fear-based educations. We do things like DARE. We put these smashed up cars outside of high schools that say, you know, this is what's going to happen if you drink at prom. You're all going to be in this smashed up car. We just try to scare people. And as parents really jump onto this because parents are terrified that their kids are going to use drugs. They're terrified that it's going to become a part of their family system. And so if other people can continue to build on that fear, anything they can do to otherize it and to keep it away from my house, my home, my community, I'm all about it. If you can arrest everybody who's ever touched drugs before so that my little Johnny stays okay, then I'm all for that, which is absolutely not realistic. So although we try to otherize this, it is a part of our society, it's there. But once this anxiety takes root, which it's done, we become very risk averse. And so we choose paths that we think are absolutely safest. So isn't it safest if we just throw everybody in jail and pretend they're not there and this never happened? Well, it's like safest for who? Right? Because I know lots of people who really, really wanted that and their kids are dead now from an overdose. So, you know, they thought maybe that was going to be the solution, but that was not the solution. So the safest path is one based on data and rationale. The safest path rebuilds our communities and maintains human dignity. So it's a big strategy. It's a conspiracy theory strategy to have this fear-based decision-making in relationship to drug policy. If we can just send everyone away, everything will be okay. So I would love to give you an hour-long presentation on how our drug war originated, because I get so passionate about that, but then I get really, really angry. I'm just gonna give you these two quotes that came from the Nixon administration. I'm not gonna read them to you, just take a second and read them to yourself. But it was 100% intentional. They knew they were lying. They knew they were targeting only subpopulations of people, and they knew it was for the purpose of criminalizing it and creating that fear and anxiety so they can continue to do whatever they do and disempower and disenfranchise entire populations of people. Sort of like the gerrymandering of districts today, but through drug policy. So, Portugal. I'm going to transition over to Portugal now. So this is a picture of what the police are doing with their funds in Portugal. They are not defunded. Police in Portugal now have shifted from stopping random individuals on the street and arresting them for personal use drug quantities, and they are actually exponentially increasing the quantities of seizures. So they've had an effect on interdiction there because they are administering their resources in that direction. They've also had a phenomenal transition in interpersonal interactions with people throughout the country. There's no longer this animosity between police and people because we're not arresting people there anymore. They have positive relationships. Drug users will actually go to police officers and ask for help and get help instead of fear of the consequence of asking for help from a police officer. They have repaired a very damaged relationship, and it took them the better part of a decade to get there. But the relationship dynamics are just phenomenal now. And this policy shift did not mean more people used drugs. Drug use still went down. Again, it's not legalized. You still can't go into the pharmacy and buy it. And if you get essentially a citation, which is essentially a ticket for a personal use quantity, you go and you get an assessment the next day. So those of you in the clinical field, you know the amount of time between when you were told to go somewhere and you actually have an appointment to be there, the shorter that time, the more likely you are to show up. Well, very next day, if you get a citation, you're supposed to be there the very next day. And you get this assessment. And when they do that assessment of personal use quantities, they found that 90% of people who get this citation for personal use don't have a problem with their use. It's not a misuse problem. It's just they happen to have personal use quantity on there. It's, you know, if alcohol were that kind of charge, then, you know, people with alcohol would be on there too. Not everyone who drinks alcohol has a problem. Not everyone who uses drugs has a problem. We do have a lot of conspiracy theory out there that you know, everyone who uses automatically has an addiction, but these are just some of those same fear tactics to create that anxiety. Just because you use a drug doesn't mean you're going to become addicted to the use of that drug. So there's been an enormous amount of success with this decriminalization, and there's been a 60% increase in access to treatment. They no longer have to fund prisons. I mean, they fund prisons, but not nearly to the rate that they used to, because we're not incarcerating people for personal use quantity. They gave that money to prevention and treatment and saw a 60% increase in treatment engagement. So for people working in programs who are afraid of decriminalization closing down their program, because that's where their referrals come from, they still get referred, even if they get charged with a citation and they say, I think you do need help, they still get referred. It's just not compulsory. The World Health Organization says compulsory treatment isn't effective and everyone who does it should stop. That's the World Health Organization. This isn't just, you know, local people here trying to stop, you know, the criminalization of drug policy. The globe is telling us that we need to change our drug policy. Their overdose rates are pretty astounding. So before decriminalization, 369, in 2016, 30. So they had a huge heroin problem. Close to 1% of the entire Portuguese population was using heroin in the 90s, which is why they made this transition. They're a very Catholic country. They're a very conservative country. And there was a battle over decriminalization. There was a moral battle over this, but they won and they decriminalized. There's no longer a battle. They said when they first started, there was back and forth over this. No one fights it anymore. The results have been so extreme and so positive that the biggest opponents of it when it first came to be are fully supportive of it today. There is no one in Portugal who wants to go back. I think we're going to see the same happen in Oregon too. We're really excited to see how this rolls out in Oregon. We're going to give you some details on what that's going to look like too. So this is actually a study of people who've gone through the Dissuasion Commission. If you went to that presentation, you know what that is. It's essentially the commission in charge of people who get a citation for drug use in Portugal. And this is how they perceive it. So they perceive the number one perception of the commission is to help you. So you know, when people get arrested for drugs here is the number one, oh wow, they're trying to help me. Is that what people think? That's not what people think. That's not what we do. That's why people don't think it. We're not trying to help anybody. They're thinking my life is over. You know, there goes my job, there goes my family, there goes who's going to take custody of my kids. Like that conversation isn't happening in Portugal. All right, so back to that research agency that was hired to work with us to look at how people in the state of New Jersey feel about the decriminalization of drugs. Here's some more data from that. I'm not going to sit here and read it to you, but I do want you to look at this. The top value statements that we have here. People need to be able to access treatment that works best for them. And treatment services need to be available, accessible, and affordable and evidence-based for everybody. So again, Portugal has something we don't have. They have nationalized medicine. Everybody can get it. If you need a treatment bed, one day you get it. When I met with Nuno Capaz, who is one of the gentlemen who was in her, she showed you a video of him in that last presentation. He said he's never been unable to get a same-day bed for somebody. Never. If you need treatment, you can get same, because they have treatment available everywhere, because they have resources for it, because we're not paying for all of these court procedures and lawyers and probation and parole officers and incarcerations for personal use drug quantities. It doesn't make sense. The equation doesn't add up. And the state, if you look at the values of the people in the state of New Jersey, they're in agreement with this. What we're proposing, it's almost like, defunding the police sounds like, decriminalizing drugs sounds like, but that's because you're just listening to the words. But if you look at what we're trying to do and why we're trying to do it and who it's gonna affect, it's really, really hard to be opposed to this from a social justice perspective.
Can I just add one thing on top of that, what she's saying? New Jersey, when they did the Sentencing Commission report, went back and looked, we spend, we're all New Jersey taxpayers, we spend $50,000 a year per person who's incarcerated. The overwhelming majority of those people are in for nonviolent crimes. Imagine if we shifted 50% of that money to treatment services, when only 10% of the people in the state get treatment. So we're willing to spend $50,000 a year to lock up somebody for simple possession, but 90% of the folks don't have access to treatment when they need it for use disorders.
Now, these are the decisions we've made as a society. This is what we've prioritized for people. And I don't think this is who we are. This is not humanity. All right, Jen, this is you.
Okay, well, I already talked about the lead, and I know time's short, and we want to talk about Oregon. We have made some progress in New Jersey, as I'm sure everybody's aware. We have right now in place, I'm very disappointed that we did not stop arrests for cannabis after we passed our ballot initiative. And by the way, all 5 states who had marijuana decriminalization on the ballot passed this year. So it's very popular with the people in the United States. But our Attorney General has said, put a hold on prosecuting folks right now, although unfortunately people are still being arrested. We've enacted all sorts of Good Samaritan laws where you again have immunity. Most people who use drugs with other people who can help them or assist them if there's an overdose. So we've been able to encourage that by saying you get immunity if you call for help with someone, even if you were using drugs with them. As you guys know, we have recently legalized cannabis, or we're in the process of doing that. It's, by the way, in the Constitution in New Jersey, effective Happy New Year 2021, and I'm sure we're all happy to say bye to 2020. Those bills are in the legislature and up for a vote this week. There's been a lot of back and drama. I'm happy to answer any questions about that. There's some really good things in those bills. There's some concerning things in those bills, but we are moving forward with that. And then Dr. Gibson, I guess you have a sequence of wonderful slides on Oregon.
Yes, let's go into that so people can see what's happening there, because we are following very similar to their model in our initiative. Oh, you doing Oregon or am I doing Oregon?
I'll give it a quick overview just to say that it's very interesting because it is quite similar to Portugal. But the bottom line, the simple thing to understand here is, again, Dr. Gibson said this several times, you can't go to CVS now and get heroin. Okay, that's not what's happening in Oregon. What Oregon has done is something very similar to Portugal. And what they've said is if you get picked up for simple possession on any number of previously illicit drugs, we're now going to give you a $100 fine, right? And it's a civil offense. It's like a traffic ticket, right? Much like Portugal. Also, if you don't have the money to pay the fine, you can go for a health assessment. So that's the effective strategy here. And all of the money saved here is obviously now getting diverted to treatment, social services, and those sorts of things. They also made another change, and this is a fight that's been going on in New Jersey here about where the cannabis taxes go, where the social equity excise taxes go to restoring communities that have been harmed by this longstanding policy. Oregon, a part of this initiative was to take the marijuana taxes and use those for social services. So it's a really interesting measure. Dr. Gibson, I'll let you talk about community access to care and the treatment, but this is very close to the Portugal model.
Yes, and they're taking these funds and they are creating addiction recovery services that greatly expand what's offered. They're following Maslow's hierarchy and saying, look, everyone's going to have housing. And we're not going to say you have to be abstinent in order to be able to get housing. It's this whole chicken egg scenario. Let's meet everyone's most basic needs before we ask them to, let's, these are people who perhaps have significant trauma histories in their lives. And so to ask them to stop using their number one coping mechanism before we give them resources to be able to take care of themselves is just not realistic. So the way that they're doing this is creating this whole process called community access to care that really makes sure everyone has access to everything they need. There's a lot of additional resources being put into peer support, which is a really affordable model to support formal treatment, but also a way for people who are doing harm reduction work to be able to transition and continue to get support before they're ready to go to individual treatment, before they're ready to seek abstinence. Recognizing, and no matter what mental health field you're in, you've learned this, meet your client where they're at. But if they walk into your door and you say, you have to stop using drugs today or you can't be here, that's not meeting your client where they're at. This is meeting them where they're at. We recognize where you are, we are here for you, we're gonna meet your most basic needs, and then we're gonna work together. We're gonna use motivational interviewing. We have the resources to provide you with housing. We're gonna make sure that you're eating, you're getting healthcare. And through this connection, we're building trust and relationships, and ultimately people are gonna be able to move and transition through those stages of change in a supportive environment with resources that help them get there. And the alternative to this is throw them in prison and disrupt their lives and their families' lives. So what an alternative. Okay, so decriminalizing is best practice policy. World Health Organization says this. There's so many reports, if you go to their website, that talk about this. They say countries need to work to developing policies and laws that decriminalize drugs and reduce incarceration. We are actually called the incarceration nation globally. We arrest more people, and if I have time at the end, I'll pull up that YouTube video. We arrest more people than any other country, than Cuba, than China, than Iran. We arrest more people in this country than any other country. When I met with Nuno Capaz in Portugal, I said, have you been to the United States? And he said, absolutely not, I won't go there. You'll arrest people for anything over there. It's crazy. I'd be afraid to go over there and be arrested and never be able to come home. And I was like, wow, that's how people look at us. That's how we're perceived by other countries. The Global Commission on Drug Policy also says the same thing. We need to move towards and support decriminalization of drugs. The UN Office on Drug Control says the same thing. We need to move towards the decriminalization of drugs. They've officially supported it, and the World Health Organization has also said this. 90% of people who use drugs don't have a problem with their drug use. We have this history of this puritanical policy that says all drug use is bad, except of course alcohol, because we've legalized that and we enjoy that very much, so that's not bad. But the other drugs, those are bad. The ones I don't use, those are bad. The ones I use, those are okay, because I just use them a little bit. Well, most people who use drugs, no matter what they're using, don't actually have a problem with their use. Somehow we feel the need, or we feel we have the right to tell people what to do, and then the right to destroy their lives if they don't do it. And these organizations are saying, well, why are you doing that? Like, what's the point? Why are you doing that? That's a really great question. Why are we doing that? All right, so we have another slide here now. It's another one of the ones from the focus group that we did where people had the dial. Hopefully this one comes through okay.
Imagine a world where we have what we need to overcome our challenges, where we can get and stay well. The truth is, life is hard. We all struggle with something, and for many. Imagine a world where we have what we need to overcome our challenges, where we can get and stay well. The truth is, life is hard. We all struggle with something, and for many, this includes addiction. Imagine a world where we treat each other with care, a world where people aren't locked away for our mistakes, but offered a way to heal, where rehab and treatment are widely available, helping people overcome these challenges. When we join together, we can make this a place where we have the support that we need to recover from addiction and shape our lives into what we imagine they can be.
Again, New Jersey is green, but clear support for this. And I have one more.
When you or a family member is sick or in pain, the number one priority is getting well, no matter what the condition. For people we love facing addiction, proven and effective programs like medication-assisted treatment and life-saving protections from overdoses like naloxone, commonly known as Narcan, are out of reach because we've put prosecutors and criminal courts in charge of an issue that requires rehabilitation and treatment. Instead of relying on failed policies that prevent many from seeking treatment or lock people away from mistakes, we need to embrace smart, evidence-based approaches that save lives and give our loved ones the chance to heal and recover.
So I often, tell people who are questioning this, I said, so if it was your kid, would you want them in prison or would you want them in Oregon? If it's your kid gets busted on a drug charge, what state do you want them in? All right, so we're going to finish up with 2 slides where we literally bullet points, so Jen will just go back and forth on this. This is why we are solid advocates for the decriminalization of drugs. It is the personal use quantity is the single most arrested offense in the United States. So the #1 charge of any kind of arrest anywhere in the country is personal use drug possession. And we can take that out of the criminal justice system, out of prisons. All those families can stay intact. All those resources that go into prosecuting, oversight, incarcerating can go back into the community. The consequences, we went over those consequences previously, are severe. No right to vote. Your children are raised in the foster care system, destroying families, can't get college loans to be able to go to college, can't get jobs. Racial disparities of over-policing in communities of color, up to, some, and this is community by community, it happens nationwide, but some communities are 25, 30 times the rate, even though use quantity is about the same. To free up law enforcement resources to use for actual violent crime, things that do keep our community safer. Arresting this kid with a gummy in his pocket does not make me safer, but maintaining your work on violent crime does make me safer. Reducing high overdose rates. Overdose rates went way down in Portugal as a result of decriminalization. Lack of investment in treatment and harm reduction infrastructure right now. We'd have the funds for that. People would stay alive, they would stay engaged, and the harm reduction is a slow walk into treatment at their pace with their right to self-determination, which is a core value of every mental health profession. We can prioritize health and safety over punishment and reduce the stigma associated with drug use so that people who use drugs are actually more likely to get help. The reduction in stigma is huge. There's so much stigma associated with drug use because of all the fear tactics. It's a part of the fear tactics. Greatly reduce the number of people who are at all involved in the criminal justice system. The resources we have could be much more cost effective. We won't be putting money into things that don't work. Compulsory treatment, if it works while they're there, but it doesn't have sustained effects. I'm not gonna say never, but it definitely does not have significant sustained effect for the majority of people who go through it. So we feel good about it, but it's not making the sustained change that we're looking for, where decriminalization does. It creates a climate for people who are using drugs problematically can actually seek treatment. It's there, it's available, it's affordable, it's ready for them at the stage they are in. It doesn't mandate that they move into a stage of action they are unprepared for. It meets the client where they're at. It improves treatment outcomes when people decide to engage in treatment and removes barriers to the implementation of evidence-based practice, of which harm reduction is an evidence-based practice. So our overdose rates are going to go way down as a result of this. So anything you want to add to those, Jen?
No, I just want to add one thing to say as an attorney to you guys. I appreciate what you do, but I did want to point this out, and I usually say this to medical doctors, which is that if you were treating someone who had diabetes, my uncle with diabetes, and he was sneaking off to McDonald's to get the Big Mac once a week, and you patient abandoned that person and wouldn't give them treatment and called the cops, we would discipline your license. As attorneys, we would call in the medical board and discipline your license. That's just egregious and not allowed. And I just emphasize that as a closing to say that this is treated so dramatically differently in the healthcare context than any other condition, problem, or disorder. And I thank you for your time, and thank you for letting me be here.
Any questions?
Thank you so much. Yeah, if anybody has any questions, they want to put them in the chat box. I'll certainly relate them to our presenters. Also, our presenters have said that they would be willing to offer this presentation to other groups, perhaps law enforcement groups, government officials and so forth. Is that right?
Absolutely.
Dr. Gibson?
Absolutely.
There was a question earlier, Dr. Gibson, when you were showing the slides of the proposed changes to policing, I believe. And the question was, what are the numbers of those bills?
Of the bills?
Yeah, you said some of the bills were ready to, or were voted on.
I think Professor Oliva was.
Yes, those are the
about
mandatory
that
minimum bills in New Jersey is Senate Bill 2586 and House Bill A4369, 2586, 4369. And those are the mandatory minimum bills that eliminate the mandatory minimums for nonviolent drug offenses and minor property crimes.
Can you say them one more time? I'm just trying to type them in the chat for everybody.
Senate Bill 2586.
Okay.
And House Bill 4369.
Thank you so much.
Thank you.
Any other questions we might have? Will these slides be available for the attendees?
Sure, I can make them available.
Great. If you could send them to me, and then if you're interested in them, send me an email and I'll send them out to you. That would be great. This has been an excellent presentation.
There's actually one more question.
Sure.
Oh.
It says, thinking about how much more money we would have for contingency management programs if we spent less money on prosecutions and incarceration. Is this being discussed at all in your networks?
So is it, our networks right now are working, I mean, it's part of the push of talking about increased resources available for treatment. Contingency management is a hard sell. I'm all on board with that statement. Contingency management is a strong evidence-based practice, and I think it makes all the sense in the world. But when you tell people, hey, we're going to use resources to actually pay people who use drugs not to use drugs, that you lose people because of the stigma that's been put upon them to begin with. You lose a lot of people in terms of trying to have consensus building. So it's not something, it's something that we would support. And if we get the money for treatment, we don't want to, and it's used for evidence-based treatment, that falls into the evidence-based treatment cauldron. But it's not something that we are putting out there saying, hey, we'll be able to do contingency management, because I think that is something that causes people to pause. So we just put it on, we file it under the promoting evidence-based practice file. And, then it can happen in there, and programs can do it. But it's not something we're kind of putting out to the public, because I don't think that that's something that moves us forward in terms of, oh, now that they're doing that, we're going to be on board. I think it might actually cause people to say, wait a minute.
I have a quick question. Does Portugal, I think Portugal has national health care.
Oh, yes. Everybody does but us, huh?
Right. But I was just wondering, how can this, states are trying it individually, but what kind of healthcare system has to exist in that state, since we don't have nationalized, in order to support this? Right.
Well, here's the thing. They're going to have the money for it. They're going to have the money for it because they're not putting people in prison. So we're talking about hundreds of millions, if not billions, depending on the state, of dollars put into prosecuting people for individual level drug offenses. You can afford healthcare with that money. When they're in prison, guess what we're giving them? Healthcare. So they get healthcare in prison. In fact, people in prison are the only people in this country who are constitutionally entitled to healthcare. Nobody else is. So we're already giving people healthcare when we send them to prison. So why not send them to prison, but still give them the health care? But the money that we would have spent on their health care in prison, we can spend on it out of prison.
Do you,
Can I add one thing to that?
sorry,
Real
yeah,
quick?
sure.
Yeah, I want you guys to
Doctor.
also just know this and pay attention to it. We're on track, and we've discussed this a bit here, to have the worst overdose death rate in 2020, and COVID's obviously a contributing factor. But because the state budgets are in such huge crisis, states with huge high overdose rates, the first thing they're cutting, harm reduction services. Georgia just cut theirs by 30%. It's going to be egregious. So in the middle of a problem ramping up really bad, we're not cutting prosecutorial dollars. We're not cutting money to the police. We're cutting the states are cutting their healthcare budgets, not their law enforcement budgets right now. And you can, again, you don't have to trust Aunt Jen. You don't have to trust Aunt Jen and her liberal propaganda. You can just Google this and read the New York Times or the state news about this. And several of the public health officials in states are really concerned right now because the little small budgets they had are getting slashed. I just wanted to add that.
Well, I also want to add that that's Aunt Jen JD. So Dr. Aunt Jen. But another question kind of related to that. Did Portugal have a for-profit prison system before this?
No. We're pretty much the only people who do that. We've decided that it's perfectly acceptable to buy and sell human lives on the open stock exchange through private prisons that have gone public, and you can buy stock in them. We're the only country that does that.
Hi, this is
It's a
Dan
layered
Mira. What a great presentation. Thank you very much. I want to put this out there. You mentioned the defunding police term, and I tend to think that's not productive language, even if because it definitely makes for a lot of confusion. People do take it at face value, and they think it means that you're getting rid of the police. So, you've got to think carefully about messaging, of course. I'm sure you all do, but I'd like to hear what you're thinking on that is. Our President Obama recently weighed in, and he didn't think that term was serving us so well.
That's how I introduced that slide, with how unfortunate I think the term is, because I think it does stand in the way. People immediately, I can't even imagine who came up with that and thought, yeah, that's a great idea. Like I wish I was a fly in the room. It is misleading, and it gives great fodder for those who are opposed to reconstructing how we fund police. And so I wish they didn't choose it. I 100% agree with you. I have it in the first slide. The second slide, if you note, was refund. It was different language. So I had their language in the first slide, and I had new language. Not that my new language is the right one either, but I think it's better. I think it gives people reason to shut their door and say, no, that's just ridiculous. I got political mailings for this election. So, because one person was supporting the defunding of the police, which obviously was not really what she meant. But the other people say, look, when you call 911, no one's going to come if you elect this person, because they don't want there to be police. Like that was part of their, opposition marketing stuff. So we need to be much more intentional about the language that we use. And I think that was very poor word choice. I think that what they're trying to do is good, but I think that they've really harmed themselves with the title that they've put on it. And I do share Obama's concern and wish they would rephrase that differently.
I agree with all of that, but I will try to be positive here. And there is like a long strand of thought in law and politics that if you do have people seeming to be really far to the other side, it pushes you maybe towards the moderates and reform. So on some level, there may be, and I'm again trying to be super optimistic here. It then has people really listen to folks like Dr. Gibson saying, hey, how about reform or diversion or funding healthcare? Because now suddenly we seem super reasonable. So I'm hoping that what comes of this is that it makes our position seem eminently reasonable, because it shoves people sort of towards a more accepting a more moderate position that's really asking for the same reasonable things.
That is a great point.
Something else that's really interesting to consider is that no one had this strong of a reaction when we talk about defunding education and things like that. And when you think about how deeply rooted our systems are in oppression, when we talk about policing and things like that, this when we use the phrase defunding the police, it is an opportunity for us to look at sort of systems of oppression and power and the way we, control and take away people's bodily autonomy. And so, we do have to think of it as more than just a policy sort of decision in those ways. And I think for a lot of us who have internalized a lot of the messages that these systems have sent us, it does give us an opportunity to look at these things and try to see them differently.
Imagine if we could reallocate these resources and give every prevention coalition a couple $1 million a year in every county throughout the state of New Jersey.
That would be awesome. I'm sending that suggestion to Dimas right now. Yeah. Once again, thank you so much. This has really been an eye-opener for many of us. I will have the recording of this made available. And Sandy, if you'll send me the slides, those of you that email me at bspreckman@mercercouncil.org, I will send the slides out to you. I want to wish everyone a very happy holiday and, safe and healthy. And in 2021, let's hope we can all get together face to face at some point. But thank you all and have a great rest of the day.
Thank you.
Thank
Bye.
you.
Holidays.